There are nearly 21,000 people living with HIV in South Carolina, and about 5,000 of them aren't getting care. My guest turned his own HIV diagnosis into a decades-long career in advocacy and public health. In this episode, you'll hear how lived experience drives innovative outreach, why meeting people where they are changes everything, and what it takes to end transmission at the community level. You're listening to the PHEC Podcast, episode 464. Welcome to the Public Health Epidemiology Conversations Podcast, where we have honest conversations with public health professionals who are creating meaningful impact in communities around the world. They know that the field of public health touches everything. I'm your host, Dr. Charlotte Hughes Huntley, and today we're exploring the fascinating journey of our guest and diving into another conversation that bridges different perspectives with the practical wisdom you need to fuel your impact. Greetings, everyone, and thank you for joining me on this episode. My name is Dr. Charlotte Huntley, and I lead an epidemiology consulting firm that supports large nonprofit organizations and community health foundations. We specialize in a variety of community assessments, workshops, trainings, ultimately helping our clients communicate their health information in plain language to their community partners as well as the broader communities they serve. Now, the support that we provide often falls in the category of strategic planning and sometimes capacity building. It just depends upon the needs of the organization. Please reach out to us through our website, drchuntley.com. We'd be happy to meet with you and explore how we might be able to support your organization. Links will be provided in the show notes. I am very excited to introduce you to my guest for this episode. What makes this episode stand out is how universally applicable the lessons are. Meeting people where they are, communicating in plain language, building community trust, and staying grounded in your why. My guest is a passionate leader who brings both professional expertise and 20 years of lived experience with HIV to this conversation. We talk about the organization's innovative approach to outreach, the real barriers driving South Carolina's high HIV rates, and the strategies that are actually moving the needle. So let me formally introduce him to you, and then I'll connect our conversation. Marco Benjamin is a nationally recognized public health leader, advocate, and HIV-positive consumer who serves as the Director of Public Health for the Joseph H. Neal Health Collaborative in South Carolina. With a career rooted in health equity, community empowerment, and innovation, Marco works at the intersection of lived experience and systems change to expand access to prevention, testing, and treatment, especially for underserved and rural communities. Marco is widely known for leading the groundbreaking Condemnation Tour, a nationwide campaign that traveled to 48 states and more than 200 cities, distributing over 15 million condoms across the country. He also served as National Director of Sexual Health at CVS Health, helping to shape and expand access to sexual health services across one of the largest retail healthcare platforms in the country. At GHN Health, Marco leads public health strategy through the organization's 4 pillars of care: education, testing, access, and retention, driving innovation through outreach, including mobile health initiatives, community-based screenings, and partnerships that strengthen linkage to care for people living with and at the risk of HIV, hepatitis C, STIs, and chronic conditions like diabetes. Let's connect my conversation with Marco right after we highlight our sponsor for this episode. Public health is about connection, and now you have a space built just for that. The PHEC Podcast community app is where public health professionals come together to collaborate, share ideas, and support one another. Inside, you'll find exclusive events like Power Hour, which is our virtual co-working event. It helps you connect with others and boost your productivity. You'll also have direct access to conversations with other public health professionals from around the world and even guests from previous podcast episodes. We're more than a podcast. We're a thriving community. Be a part of it. Download the PHEC Podcast community app today and join us. Welcoming my guest on this episode, Marco Benjamin. Welcome to the podcast. How are you?
I'm doing great. Good morning. Thanks for having me.
I'm excited to have you and get to know about you and the work that you do, and really excited because you're right here in my local area. So I'm especially excited to get to know you. We're going to get to know each other in real time in this podcast episode, and everyone else will get to hear about you and learn about you as well. But I'm a little geeky excited because you're my neighbor right here locally, and that doesn't happen very often. Why don't you take a moment and just introduce yourself, tell a little bit about what you do?
Sure. So again, thanks for having me here and having this important conversation about public health. My name is Marco Benjamin. I serve as the Director of Public Health at the Joseph H. Neal Health Collaborative here in South Carolina. For those that are not aware, Joseph H. Neal was a state representative for about 25 years here in South Carolina. And, some of the issues that he was able to address here was taking down the Confederate flag that waved in front of the State House. And then in addition, in one of the other issues were back in 1993, HIV testing was not private and confidential. And so Joseph H. Neal was very instrumental in adding that privacy component to testing. When it comes to HIV testing. And so my work centers around what we call intimate health and making sure that people have access to education, testing, treatment, and then also long-term care. This work is so urgent because here in South Carolina, we have nearly 20,000 people living with HIV. And it chokes me up because it's an issue of public health, right, and safety. And hundreds of new cases are being diagnosed here every year. And currently about 5,000 people are living with HIV and are untreated. And so this really, creates barriers for the work that we're trying to do here across the state.
Yeah. Extremely important work. And looking forward to diving more into what you do here. Before we do that, I always like to roll back the time a little bit and get to know you through the journey to where you are now. Do you remember a time when you first learned about public health or considered public health as a career?
Looking back, I didn't think I would be here today. Right. I'm a person with lived experience. And so I am someone that's been living with HIV for the past 20 years and has really shaped the work that I've been doing. Previously, I studied to do architecture, and I was actually designing homes for folks, and particularly in homes that I would never get an opportunity to live in. Right, these big, lavish homes and bathrooms the size of a studio apartment. And I contracted HIV. I didn't have enough education. I grew up in New Brunswick, New Jersey, and New York City. And I tell folks, now I'm just as old as AIDS. Right. And when the first HIV diagnosis was discovered, Amazon was only a river. And so we're talking 45 years ago that I was born, and I didn't get enough education, whether it was family or through the community or through the public health systems. I just wasn't educated. And I contracted HIV, and I was able to turn something so negative into positive. And I recall when I was first diagnosed, I wanted to go to Africa to help people because I didn't realize how much HIV was in my backyard. And so I was looking for missionary opportunities. And I was told by someone, yes, we can send you to Africa for 2 weeks and you can help people, with HIV, but it's going to cost $5,000. didn't make sense to me. That's not what I was looking for. And so shortly after, I applied to a Craigslist posting about looking for protesters to protest against drug pricing in New Brunswick, where Johnson & Johnson headquarters was at. And so I said, let me go. That changed my life. And I often tell folks that HIV has changed my life. I'm now knowing what we know. I'd rather have HIV than diabetes. I'd rather have HIV than cancer. And that's a very strong statement. But I'm now educated as to where once I was not. And so my initial journey is advocating for folks that could not advocate for themselves or were too scared to put a face to HIV. And it's because of the support system that I still currently have today, which is my mama and my family. And when I explained to my mother, I was first tested at a partner's home before you were able to access HIV test kits in your home. And he worked at a hospital. And so I was tested and I tested reactive. And I called my mama the next morning. I said, I'm going to ruin your day. And she goes, what's the matter? I says, Mom, I tested positive for HIV. And she gasped. She goes, oh, I thought you were going to tell me you were in jail. What's the problem? Blew my mind. I says, Mama, you don't understand. I now have HIV. And she tells me, son, you're not going to be the first nor the last. What is the problem? And so that really assisted me to be able to go out and advocate. If my mama didn't care, then why should anyone else care? And so I created a T-shirt one day. I took some markers and I wrote on a white T-shirt, this is what HIV looks like. Either Facebook or MySpace at that time. Depends on what was popular. It was probably the both of them. And I changed my profile with that shirt. And it actually created a statement. Thousands of people from all over the world was messaging me of courage. I still get emotional today. Thousands of people saying, I could not do what you just did. So thank you for doing this for me. And so it started a roller coaster. I says, well, if I can do this with a picture, what can I do in front of a state house? What can I do on the ground at a grassroots level? And so I started volunteering for a nonprofit recognized organization called AIDS Healthcare Foundation. And I did a lot of grassroots activism. Successfully, we were able to bring attention and call attention around the Hershey Milton schools that discriminate, which is based out of Pennsylvania, and in fact was to help underserved and underprivileged young folks with education. And they discriminated against a young person, 13 years old, who had HIV. I never met the gentleman, but I went to every Hershey store across the country, every candy expo, and we created a movement of boycotting Hershey. In boycotting Hershey, we realized how much candies are Hershey's. That's all the good ones, you know. We didn't stop until they allowed the young man back into the school. And it took about a year or two advocating for someone I didn't even know. But I was advocating for something right because I was that person. I was that student, right? And so I was honored to meet the young man after winning litigation. He was supported by his mama. And so mamas are strong. And so I would not be in this work if it was not for my mama. And so that has allowed me, and that's kind of where I started, very on the grassroots level and worked my ways through to be able to find myself in other rooms, not just, I realized that the work that I'm doing, screaming and yelling in front of buildings and teaching folks and educating folks that their policies and procedures don't help stop the transmission of HIV, I realized nobody's listening. And so I was afforded an opportunity after I worked at AIDS Healthcare Foundation. While at AIDS Healthcare Foundation, I even ran a condom tour. I went to about over 200 cities, 38 states, and I distributed 15 million condoms. at bus stops, at shelters all over the country, drove cross country 10 times, and still did not feel like I was creating effective change on the ground. And I was afforded an opportunity to become the first HIV patient advocate with CVS Health, and realized that I can still create change, but behind the curtain. And so once I was in front of the CVS buildings trying to advocate for effective change, and I found a way to get inside and work together with folks at CVS to continue to create that effective change, but more on a corporate level. And in this work of activism and advocating, we forget about ourselves, right? And I think in public health as well, right? We forget about ourselves. We forget we are the patient. And I needed a break. And I took a break. The break was well-deserved. I went to Puerto Rico. I'm from Mount Navo, small rural town. We have a 200-acre family farm that runs the coast of the beach. And I went back to go be one and humble myself. And I says, I'm never going to do this work again. Never again. This was about 3 years ago. And quickly, while there, Hurricane Fiona happened. It wasn't as bad as Maria, but was without water and electricity for 22 days in the summer. And most importantly, my neighbors needed help. And it wasn't about HIV. It was about community. It was about grassroots work. And so quickly humbling myself, I learned that I was meant to do this work. And by me sitting on a beautiful farm, eating fresh fruits, was not frankly where I needed to be at this time. And so I was called back home by Joseph H. Neal's sister, who's our founder and board member at the organization, Miss Wilma Neal Garin, to come back home and help the organization, but most importantly, help the state of South Carolina win the war on HIV/AIDS.
Thank you for sharing for being vulnerable and sharing your story. I mean, this is really powerful. It's so many lessons about advocacy and power of really showing up for people who can't show up for themselves, and that impact, that ripple effect, it's just amazing. And thank you for taking us, kind of filling in those gaps and bringing us along this journey. I would love to talk a little bit more about South Carolina and what you're currently doing. Please share more about your current role. We have a sense of who you serve, but really how, like what programs or services that the organization, provides through your role. Just what can you share with us about that?
And thank you again. I mean, we're neighbors, right? And so it's really great to bring, visibility to our state, and most importantly to the folks that are going to follow and listen. At Joseph H. Neal Health Collaborative, we serve communities across South Carolina, and that's any South Carolinian. Joseph H. Neal, when he advocated for the non-closures of rural hospitals, it wasn't because there were poor Black people in rural South Carolina. It was poor people who were South Carolinian, right, that lived in rural areas. When Joseph H. Neal, advocated for taking down the Confederate flag, it wasn't because of a certain minority. It was because it created barriers for even people who do not speak English, whether they're Latino, Creole, Haitian. They're South Carolinian here. And so we maintain his legacy by ensuring that we are servicing South Carolinians here and really ensuring that we're being able to create, healthy pathways. And so we have learned, especially in this time, that we have to pivot some of our work. And when we talk about HIV, it's associated with stigma, with the LGBTQ community, QAI community. It's associated with intravenous drug use, and it has a very bad look when it comes to HIV and sex, because nobody has sex here in South Carolina, right? But when you think about it, and some things that I tell folks, we're all here today because our parents had unprotected sex. They didn't use a condom. But how do we wrap that up with education, literally? And so what we have learned is that folks are not letting us in the room to talk about sex like Salt and Pepper did, right? And so what we've done is we've had to rebrand a little bit and pivot. And so what we provide is intimate health education and intimate health testing and screening. And it allows us to be intimate with your diabetes first. And in fact, we have the most amputees in 29201 in all of the United States of America right here due to diabetes. And so through an HIV test, we're able to be intimate with your diabetes, intimate with your hepatitis C, intimate with your sexual health risk factors, right? And so what we have done is we are funded through the state to be able to provide free HIV, hepatitis C, sexually transmitted infections testing and treatments for free. And when we look at that this past fiscal year, we're coming up on the end of the fiscal year now in July, we've tested approximately 2,500 people. We've cured over 30 people with hepatitis C right here in South Carolina for free. We are navigating folks to life-saving medications such as PrEP. And PrEP is a medication that you're able to take once a day and not contract HIV. This is huge. This is amazing. This wasn't around when I became HIV positive, right? In addition, we're engaging in people's sexual health here. The folks that are coming into, we have a brick and mortar location in Casey on State Street. And for the ones that know South Carolina, it's in front of the Lizard Thicket, which is a great place for breakfast and collard greens.
That's right. Don't let the name fool you.
And if you know, you know. And so we have a clinic component here where we have our chief medical officer, Dr. Carl Mitchell, who's an endocrinologist specialist. And we have a nurse practitioner, registered nurse, and we have about 5 intimate health screeners, including case management. All of our work we see starts with education. And so we've created 4 pillars to care, which is education, testing, access, tension. And we've seen in our work here that the biggest pillar is education. Educating folks in communities that HIV and PrEP is not a gay thing. It's a South Carolinian thing, right? Again, we have over 21,000 people here in South Carolina living with HIV. About 5,000 of them are not engaged in their care or virally suppressed. And so there's 5,000 people out there every day potentially infecting other folks. And so we provide those education to folks. It's even educating folks that HIV criminalization is a real thing here in South Carolina, where if someone knowingly has sexual relations, not past the virus, knowingly has sexual relations with a partner here, you go to jail for attempted manslaughter for 10 years. And so it is a double-edged sword, for some folks. We see that things like that in legislature help create barriers, just like the Confederate flag did for folks to be engaged into their health. Have found ways to be innovative in educating folks around the risks of contracting HIV and what that looks like now, and then to test. We usually have a sign out that says free HIV testing. That doesn't work in Kingstree, where 95% of the men are unemployed. We have to put out free intimate health screenings and lead with a hepatitis C test. And then while we're there educating them, can we have one more drop of blood to test you for HIV? And so really shaping, we're not an HIV organization. We are a collaborative. And that's why we are Joseph H. Neal Health Collaborative. We're utilizing HIV as an anchor to address social determinants of health, right? To address food insecurities, to address housing, just to address someone just to say, I love you. Right? That's social determinants of health before we're looking at a prescription and a test. We have also been a little innovative in knowing that this is a very big, and I am not a native South Carolinian, although I did do my basic training at Relaxin' Jackson many moons ago. And so I say that's what brought me back. It prepared me to be here today for the war on HIV that we're experiencing right here in South Carolina. But being here now, I see that this is a big sports state. Everything's sports. And so what we have done is if you're a parent or you're a student and you need a sports physical, we will provide a free sports physical if you take an HIV test. And it's free. If you need a DOT physical so that you're able to drive a CDL truck so that we can get our produce and our products, if you take an HIV test, we will see you for free. And so we're incorporating that in our workflow and everything that we do as part of the education. We'll still see you regardless, but that is the gateway to seek our services here, including now managing chronic diabetes. The bulk of our work, as I continue to say, is education like we're doing today, right? We're educating, the listeners and also you, Doc, about the services we provide, but really what's going on? This is that silent killer that nobody's talking about. I think I said a little earlier also that education is wearing a red hat that says make sex safe again with black letters, right? That is education, being in front of people's face and letting them know. And so we are positioned at the right time and in the right place to end the war on HIV. At Joseph H. Neal, we have representation, myself and some colleagues at the state level HIV Planning Council that allows us and allows our voice to be heard in shaping how we want HIV to look like here across the state. In addition, I sit as the chair for the PHEC committee, which is the Positive Advocacy Committee, which is folks with lived experiences just like myself. And it's about 60 of us. We are an advisor to the state health department and how they are to shape HIV and public health for our community. And so we're really working together strategically at Joseph H. Neal, which I think is a very huge win for ours, whether it's at the State House or even just with community partners, working strategically and not siloed to be able to provide our intimate health services. And we currently, there was 1,500 new HIV diagnoses, and in South Carolina, when it comes to HIV and sexual health, we're first in high rates. And we would love to be last in that number. I'm a newly Latino identified South Carolinian, but I'm no stranger to HIV, and HIV does not discriminate whether you're from South Carolina, Africa, New Jersey, black, white, green, or however you decide to self-identify. There's no discrimination with HIV.
I appreciate the details and listening to you. And a question that comes up is, I feel like I have some ideas about this living in South Carolina for 20 plus years. But what is the biggest challenge you see with addressing HIV in South Carolina, with us being at the top of the charts, the highest rates? I mean, what's the biggest challenges that you see?
I go back to education. We have folks engaging into our services because it's itching, burning, and or dripping at the same time. So that's syphilis, gonorrhea, chlamydia. And they're coming in engaging this because no one has had this conversation with them. I'm an outsider from South Carolina. I think I've been here long enough to say that there's a heavy religious, community here. And religion and sex oftentimes are not spoken about together in the same room or taught about, right? We're taught about do unto your neighbor, respect thy mother, respect thy father. But no one is passing around a plate of condoms. No one's having these intimate conversations with parishioners that are teenagers who are pregnant, right? And so for me, sometimes abstinence only does not work. We educate our children to wear their seatbelts, don't drink and drive. We need to find a way to have this comfortable conversation with our communities around sexual health. I believe also, as anyone can see, it's rural, right? It's a very rural part of the country. I see that in Colombia, there is an oversaturation of these services, but the services are not meeting people where they are. So we go to King Street, 4th of July, to their July 4th parade. And when I first went, I was like, I'm going. There's going to be hundreds of people, Mr. Benjamin, so many people. And I went. There was a parade of about 10 cars, people on horses and ATVs. And I felt like I was at home in Puerto Rico. And that was a parade. That was huge. We were able to test about 50 people out of our van that never have been tested before in their life for HIV. And it's because we came to them. We didn't expect them to come to us. And so, although many folks are trying to meet people where they're at, you truly can't meet them where they're at if you're sitting behind a desk or you're sitting in a clinic waiting for them to come in. Look at gas prices. You expect someone from King Street to drive 2 hours here with no air conditioning, right? And then worry about their health. It's impossible. And so we also see that I see here that the other issue could be is language. We have a high population of Latinos that are working the farms. They're not being engaged. They're not being taught or being walked with along the same paths as the other South Carolinians have had before. There seems to be a disconnect, particularly with the Latino population, where the language is not for them. The advertisement, even for the Black and brown communities, it don't look like us. The people that are providing the services don't look and don't talk like us. And so I think that in public health, one of the issues here as well, with education, some folks here do not have the education level to understand the word vagina. The word, infectious disease, secondary opportunistic infections, and why. And so what we try to do is explain it in very layman terms. Is it itching, burning, dripping? And that's actually a campaign that we're doing. Instead of syphilis, gonorrhea, and chlamydia, folks don't know what this is. And so what we're seeing, and in addition, what I see here is that PrEP medications have been around for 20 years. And when we have folks coming in, we're engaging them. Hey, this is your third time here with a sexually transmitted infection. Let's have a conversation about PrEP, because the next time you come in, I'm going to be giving you an HIV diagnosis. Folks are saying, what's PrEP? That's something new. I'm going to grow another ear. I'm going to wait until somebody else gets on it and see what happens. And that's frightening. I utilize myself as an example often. And even when I'm engaging in folks, they'll say, oh, I'm clean. And it's when you provide a negative result to somebody, they would say, I'm clean. And I will look at them and say, well, then if you're clean, doesn't mean I'm dirty. And they're like, no, you're not dirty. Well, I am HIV positive. I'm not dirty. You're HIV negative. You're not clean. And it's okay with me because I'm the person in the room. But if you had said that with somebody else in the room, it might stigmatize about their own selves, and it's going to actually create a barrier for that self. So let's try to use reactive, non-reactive, negative, positive. And then we're realizing that folks are not educated that you equals you. Undetectable equals untransmittable. So someone like myself that is engaged into my medical care and also my treatment, I am what's called, my virus is undetectable, which means that I cannot transmit the virus to a sexual partner. And so there's a big movement across the world, U equals U, undetectable equals untransmittable. And we're hoping to get a lot of that education out, but we see that folks are fear that we can contract or they can contract the virus through their partners, but not understanding that folks who are routinely engaged in their care, they won't even pass the virus. And then lastly, I think that we're still behind the times here. I say that South Carolina is the right speed of slow. I'm from New York, where everything is fast, fast, fast. I see it as an opportunity now more than ever that we can really end HIV, the transmissions of HIV here. There's not children being born with HIV as there once was, right? But I think because of the state that we are in and kind of where we are at, we're often forgotten. Even in corporate America, there's the Northern Territory, there's the Southern, you got the Midwest, but they forget about South Carolina. It just like the Northern stops just at North Carolina and the Southern stops at Georgia, but they forget about us here. And there could be umpteen more reasons that we're not winning here and keeping the numbers down. But I think those are some of the reasons that I've seen here outside of culture that we're not winning.
I think that this is opening up. We'll definitely continue a conversation because I think that this gives us an opportunity to even brainstorm a little bit. And I love all of the effort that the collaborative is putting forth. Thank you for educating us in this conversation today because there's just a lot to process and there's a lot of information about what's happening in my local area. I'll look for opportunities to, see how I can be a part of the support and the effort to continue to serve our citizens across the state. And I think our listeners, are taking away some insight about what's happening in South Carolina. Maybe they can compare to what they're doing in their area. In a moment, I'm going to connect all the information to connect with you. The collaborative will be on the show notes page, and I'll tell everyone how to connect with you. And maybe there's some brainstorming. They like to have a conversation. I'm hoping that wheels are turning. But for now, I'm going to kind of find a way to wrap this up. And I'm pretty sure I'm going to have to bring you back in the future. And we'll continue this conversation. But I appreciate you so much for coming on the podcast. And like I said, for being vulnerable and open and sharing in the stories, the education, just every bit of it has been so refreshing and insightful. And I just really appreciate you for that.
Yeah, we thank you. We can go days on in talking about HIV and sexual health. If I can give a little bit of advice, it's very simple. We need to stay grounded in the why. This work can be challenging, but we tell folks to never lose sight of the people you are serving. And don't be afraid, especially now, to think differently. Community-based solutions are where real change happens. And that's where we're at Joseph H. Neal.
Love that. That's an incredible takeaway. And it resonates so strongly with things that I say all the time, too. I think it's so important, that being grounded in our why gets us up every day, keeps us going when it's challenging, showing up our best. So I appreciate that. Thank you for adding that and rounding things up for us.
Thank you. I appreciate it.
I really hope you enjoyed that conversation as much as we did. This conversation is a reminder that the most powerful public health work starts from personal experience. My guest's journey from grassroots activist to organizational leader shows what's possible when you stay connected to the people you serve and refuse to wait for them to come to you. The lessons here go beyond HIV, meeting people where they are, using plain language, building community trust, and never losing sight of your why. Wherever you are in your public health career, I hope this episode challenges and inspires you. I do encourage you to connect with Marco and learn more about the great work that he's doing at the Joseph H. Neal Health Collaborative in South Carolina. I know I live right here in South Carolina. I'm especially excited to have gotten to know him, and I look forward to connecting with him. We've talked about meeting in person, which is always a treat for me to find someone close enough to be able to do that. So I look forward to staying connected with him and learning more about the work that they're doing, and I encourage you to do the same. You can find the links to connect with him on the show notes page. The show notes page for this episode, which is episode 464, can be found at phecpodcast.com. Once you're there, just navigate to episode 464 to find its show notes. One more thing before we go. Remember that our podcast has an app and private community that is independent of social media platforms. This is where you can engage with public health professionals around the world. In addition to being a part of this amazing community, your membership supports the production of this podcast and episodes just like this one. You can download our PHEC Podcast Community app in your mobile app store, and it is available for both Apple and Android users. You can also visit phecpodcastcommunity.com to join the community on desktop. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening. The show notes page is where you'll find links to everything we discussed in this episode. To find the show notes for all of our podcast episodes, just visit phecpodcast.com.